Thank you for your presentation. Let's now go to Module 2 of this program.
Insect-borne diseases have always been a threat to humans throughout the world. Despite the progress of modern medicine in preventing and treating such diseases, they remain a huge problem worldwide. A perfect confluence of an increasingly large world population, instantaneous international travel, and increased climate change have conspired to make the worldwide risk of insect-borne diseases a major problem today and in the future. The increase in human population has resulted in more easy disease transmission than was the case for isolated ancestors who lived in secluded communities and tribes, not in super cities that span hundreds of miles. At the same time, the enormous increase in air travel over the last century means that disease outbreaks in one continent can be transmitted to another continent in a matter of hours. Simultaneously, climate change means that many insects that formerly lived only in the tropics have migrated to non-tropical temperate climate zones, increasing the footprint for insect-borne diseases. According to the National Geographic Society, climate change is spreading illnesses such as West Nile virus, Zika, and malaria into new places as temperatures push mosquitoes into territories where they never existed, including places like the highlands of Ethiopia and the northern United States. According to microbiologist Stanley Malloy, former dean of the College of Science here at San Diego State University, quote, "Probably everyone is going to feel this at some point in their lives. It may be a mosquito-borne disease in a place where it didn't used to be. It may be a simple case of salmonella, but it is going to affect us all," unquote. Mosquitoes are the primary culprit in the transmission of diseases, though ticks and fleas are also potentially dangerous disease carriers. Beetles and other insects can pose substantial environmental risks, though the threat is primarily to trees and crops and only indirectly to humans. At the top of the list of dangerous diseases is malaria. Malaria has afflicted humans for 10,000 years and has killed tens of millions of people. The World Health Organization estimates that in 2015, there were 214 million new cases of malaria, resulting in 438,000 deaths, with some estimates ranging up to 500 million infections. Malaria kills one child every 40 seconds somewhere in the world. Unlike other diseases, malaria is spread by females of several species of the Anopheles mosquito that live in equatorial regions of South and Central America, the Caribbean, Africa, South Asia, and Oceania. Unfortunately, over the past 50 years due to climate change, the range of malaria-carrying Anopheles mosquitoes has spread into new locations in Mexico, Argentina, Peru, Southern Europe, and the United States. Malaria has also played a huge role in the history of the Western Hemisphere. Slaves were brought by European Americans to the Caribbean and the Americas due to the genetic resistance of most West and Central Africans to malaria. Instead of enslaving Native Americans, millions of African slaves were imported that had a huge effect on the history, warfare, discrimination, and racial composition of virtually all American countries. In the United States, the Great American Civil War was fought over the issue of slavery. The politics of the United States is still, in part, driven by ancient allegiances in former slave states in the Confederacy and the former free Union states in the North and West. Brazil imported more than 4 million African slaves and has more people of African ancestry than any country outside of Africa. Many tropical diseases are transmitted by a common insect, the Aedes aegypti mosquito. Although the headlines have focused on the Zika virus in the news, the mosquito transmits dengue fever, chikungunya, West Nile virus, yellow fever, and other less common diseases. Over 1 million people in the world have become infected each day with dengue, chikungunya, or Zika. The recent and devastating Zika virus has spread rapidly across Africa, North and South America, and the Pacific. According to the U.S. Center for Disease Control, the CDC, although chikungunya only has appeared in the last few years in the Americas and the Caribbean, in the first year, over 1 million people were infected. The World Health Organization reports that in 2016, over 1 million people per day contracted either Zika, chikungunya, or dengue. There are over 400 million dengue infections each year in over 125 countries. The Zika pandemic is particularly devastating. Unlike other mosquito-borne diseases, Zika often has a catastrophic effect on infants whose mothers have contracted Zika while pregnant. These infants are often born with neurological problems, and many are born with microencephaly, a condition where the brain fails to develop properly, resulting in a much smaller head. The result is a lifelong intellectual debility, poor speech, impaired motor function, dwarfism, seizures, and abnormal facial features. Several cases of blindness have been reported in babies born to mothers with the Zika virus. Even children born to a mother who has Zika that do not experience microencephaly may have a host of other cognitive problems and learning disabilities. There is also some evidence that children contracting Zika can have damages in the retinas of the eyes, resulting in blindness or visual impairment. Even some healthy adults have long-term problems after contracting Zika. While many adults with Zika have no apparent symptoms, others report mental fogginess, forgetfulness, exhaustion, headaches, and sleepiness. A small percentage of Zika patients contract Guillain-Barré syndrome, often called French polio. Guillain-Barré is an autoimmune disease triggered by a virus. Most often in the last few years, the Zika virus is the culprit. While some patients recover fully from Guillain-Barré, many people have long-term paralysis or other neurological problems. Recent research at Johns Hopkins University revealed that some Zika patients had encephalitis, a long-term swelling of the brain, and transverse myelitis, and inflammation of the spinal cord. Additionally, Dr. Karina Gonzalez-Carda, a Mayo Clinic doctor working in Venezuela, reports that a smaller number of previously healthy patients with Zika developed heart problems, palpitations, and shortness of breath. Fortunately, Zika cases have dropped dramatically in the summer of 2017. Experts think that it infected so many people that much of the population is immune to Zika, creating what is often called herd immunity. When a large percentage of a population has been vaccinated, or in the case of Zika, has already had the disease, the virus has fewer hosts and the epidemic slows. But caution is advised. because like the last huge outbreak, it may recur where fewer people are immune. Zika is far from gone, but has not entirely disappeared. Brazil, which had 250,000 confirmed cases in 2016, had only 14,000 confirmed cases in 2017 by the end of July. But 14,000 cases is still a lot, and each traveler that contracts Zika can bring it to a new, previously uninfected area. Of great concern is that there are still increases in Zika in northern Mexico and in Texas. In Puerto Rico, Zika cases have dropped in 2017 by over 90%, but new cases have still been reported in 49 of Puerto Rico's 78 municipalities. Ecuador, Bolivia, Argentina, and Peru have reported recent increases in Zika cases after substantial reductions in 2017. According to Science magazine, quote, transmission persists at low but steady levels in some parts of Latin America, including Mexico, Peru, and Colombia, agrees Alessandro Vespasiani, a disease modeler at Northeastern University in Boston. Michael Osterholm of the University of Minnesota maintains the Zika infection comes and goes in the population. You can have a bad year or two and then have a year where there is less infection and some people feel it's going away, which is not the case at all. It will come back. We have to understand that we're in this for the long haul, unquote. Recorded cases of Zika are just the tip of the iceberg because 80% of the infected people have no symptoms, he says. So Zika may be dramatically underreported. Worse, the immune signature of Zika in both dengue and chikungunya are so similar that the standard diagnostic tests cannot tell them apart. So we are not sure to what extent Zika is actually declining. At the height of the Zika epidemic, women were advised in some countries not to get pregnant. That advice is no longer operative, but women should still be careful. Pregnant women or women planning to get pregnant should take standard mosquito prevention measures, including insect repellent and clothing that covers the body. Once a woman is pregnant, they should avoid mosquito-prone areas, and their partner should continue to use condoms since Zika is transmitted sexually and can lurk in a man's body for months. After one partner has contracted Zika, medical experts believe that condoms should be used for at least 6 months. The fact that Zika can be sexually transmitted makes it an even trickier disease to control than its cousins dengue and chikungunya. It means that transmission can occur from travelers that contracted Zika elsewhere, returning to a country with no Zika and virtually no mosquitoes. It suggests that it could recur in any sexually active gay or straight population. Obviously, like other sexually transmitted diseases, standard precautions are necessary. Either practice abstinence or, during sexual activity, avoid the exchange of bodily fluids. The first line of defense against potentially dangerous mosquito bites is clothing. Long-sleeve shirts with collars, long pants, socks, and hats that cover most of the body provide good protections. But the hands and face are typically uncovered. Likewise, a full set of clothing may be impractical in very warm climates where mosquitoes are most prevalent, or during activities at the beach or pool. So, in these cases, a mosquito repellent may be needed to complement clothing as a defense. The solution for avoiding all mosquito-borne diseases is the same. First, it is very important to use a mosquito repellent such as DEET. Although DEET is the most effective insect repellent ever invented, it works for virtually everyone, but it does have some side effects. People do not like putting a chemical on their skin that has been known to cause problems for about 25% of its users who've had at least one side effect, including headaches, numb lips, rashes, nausea, and dizziness. Importantly, there are no known birth defects from expectant moms that uses DEET. For people concerned about the potential side effects of DEET, they can use a natural mosquito repellent that provides some protection, but it is not generally as effective as DEET. According to the Scientific American, botanical repellents were effective for just 20 minutes on average, compared to 300 minutes for DEET. However, the side effects of botanical repellents are minimal. Lemon eucalyptus is proven to be fairly effective and now available in several products. Some other safe products with fairly good effectiveness are citronella, geraniol, and essential oils. Please realize there are some trade-offs between effectiveness and side effects. Since mosquitoes are most common in warm, humid, sunny regions of the world, it is important to use mosquito repellent and sunscreen simultaneously. People should not use combination sunscreens and insect repellents, as they are less effective for both sun protection and deterring mosquitoes. Most experts agree that it is best to apply sunscreen 20 minutes before applying insect repellent, so the sunscreen can be fully absorbed into the skin. Moreover, it is the scent of DEET that repels mosquitoes, so covering it with sunscreen will reduce its effectiveness. The Aedes aegypti mosquito is quite common and can be recognized by the white marking on its legs and the marking in the form of a lyre on the upper surface of its thorax. Preventing bites from the Aedes aegypti mosquito is a little tricky. First of all, unlike most mosquitoes, this mosquito can be found indoors as well as outdoors. Indeed, it breeds inside, and its longevity is increased indoors. In fact, they prefer the indoors. They are commonly found under beds, desks, in closets, behind washing machines, under couches. They emerge around dawn or shortly afterward, and again 2 hours before sunset, to bite people and pets to obtain blood meals for their eggs. Traditional mosquito control methods are increasingly ineffective with Aedes aegypti mosquitoes and becoming more and more ineffective. The Aedes aegypti is now resistant to many common insecticides, so spraying is not always viable. Worse yet, pesticide-resistant mosquitoes pass along their resistance to future mosquito generations. Removing standing water from barrels, old tires, bottle caps, cups, bird baths, and pails is very important in mosquito prevention. The Aedes aegypti mosquito is lazy and rarely travels more than half a mile from where it was born unless carried by car, boat, or airplane. This means that local efforts at mosquito prevention can be effective, particularly with the removal of standing water from the community. Other environmental forms of mosquito prevention are also important. If mosquitoes cannot be prevented from entering a house, mosquito netting over beds can prevent the indoor bites that often occur. Making sure every window has a screen and that the screens are in good condition with no holes is imperative. Best of all, keeping windows shut and using air conditioning is optimal for mosquito prevention. Making sure that doors to the outside are always shut and that kids know not to run in and out of the house are important to good mosquito prevention. screens and air conditioners are not common among the poorest communities in the world. So spraying, eradication, insecticide, and water removal is even more important in poor communities. Most effects of climate change, such as dangerous droughts and rising seas, make the headlines. However, more subtle but very important changes in complex ecosystems that can change insect habitats and spread disease that can be dangerous to humans, other animals, and forests. Such is the case with ticks and beetles that are increasing their range and causing problems in new areas. Mosquitoes are not the only disease-carrying insect that is hazardous to humans. Ticks also are transmitters of various dangerous diseases. According to National Geographic, in Europe, Lyme disease, once confined to the south, is showing up in Sweden. Winters are no longer cold enough to kill ticks, and they have a head start in the next spring. Likewise, in the Ural Mountains in Russia, they've had a 2,000% increase in tick-borne encephalitis in the past 2 decades. Lyme disease gets the headlines, but ticks carry a host of diseases. According to Scientific American, ticks are nature's dirty needle, and they continue to spread to new parts of the world. Lyme disease is the tip of the iceberg, cautions Durlin Fish, epidemiologist at Yale School of Public Health. Quote, "There are worse diseases coming down the pike," unquote. According to Thomas Mather of the University of Rhode Island, a single tick can carry numerous pathogens and constitute a smorgasbord of risk. Dozens of tick-borne diseases are showing up in new areas. Ticks are now common in Alaska and northern Canada, where they were never found previously. Regions such as Central and South America are particularly affected by Lyme disease, where several tick-borne diseases reports are on the increase. Several Caribbean islands, Argentina, Belize, Bolivia, Brazil, Chile, Colombia, Costa Rica, Honduras, and Mexico have reported isolated yet increasing numbers of cases of Lyme disease and other tick-borne diseases. In fact, disease-carrying ticks are found in every continent except Antarctica. And it is not just the deer tick famous for its link to Lyme disease. The Center for Disease Control and Prevention, the CDC in the US, lists on its website the tick species in North America, including the American dog tick, the black-legged tick, the brown dog tick, the Gulf Coast tick, the Lone Star tick, the Rocky Mountain wood tick, and the western black-legged tick. These ticks not only transmit Lyme disease, but a host of other diseases as well. Researchers are learning that ticks can actually survive 1 or 2 cold snaps, whereas in the past, more numerous cold weeks killed the ticks or at least limited their spread. Like mosquitoes, most ticks are deterred by DEET. So when people are in known tick-prone areas, particularly brushy or densely wooded areas, use of an insect repellent is a good idea. Since dogs are very susceptible to ticks that hide in their fur, using a tick powder or repellent on furry pets is advisable as well. Fortunately, ticks have to be attached for over a day to spread disease. The longer they are attached, the more likely they can infect their human or canine hosts. Making sure clothing and hair are free of ticks after outdoor activity is imperative, and the best way to avoid contact with many tick-borne diseases. Although not deadly to humans, the bark beetle and its relatives are playing havoc with the world's forests. In Mexico and the United States, the bark beetle has dramatically increased its range and impact due to climate change. Worse, by killing trees, the beetle increases carbon in the atmosphere. Climate change prevents the hard freezes that kill beetle larvae, allowing these insects to thrive in areas previously inhibited by cold temperatures. From Mexico to Alaska, bark beetles have devastated forests. Millions of trees have been lost in Mexico, the United States, and Canada. Just in the states of Colorado and Wyoming, the bark beetle has killed more than 4 million acres of trees. Canada's British Columbia has lost 805 of its trees to beetle infestation. According to the New York Times, the next 3 to 5 years, every adult lodgepole pine in Colorado will have been killed. In a warming world, that is highly likely. Now the infestation has struck in the mountains of Europe, South America, and Africa. Only when these areas return to winters, with many weeks of temperatures below minus 30 degrees Fahrenheit, will this plague be stopped. As we have stated at the outset, environment and human health have become strategic resources in our globalized society. We have entered a new era in human history. Global warming, degradation of land, water, and air around the world are a product of irresponsible human activity created by poverty, lack of education, obliviousness, and often greed. We live in an interconnected world populated by over 7 billion intertwined individuals. There are no boundaries to climate change, new diseases, global pollution, or economic crisis. Our independence and world dynamics now, more than ever, require creativity, innovation, and special attention to the challenges and problems derived from the abuse and myopic treatment of these vital world resources. A holistic or systemic approach to the enhancement and management of health and environmental quality is now essential for countries, communities, organizations, and individuals all over the planet. Along with Drs. Miguel A. Cardenas Sr. and Jr., founders and producers of the International Training Center, I am working with Sierra Club and San Diego Global Knowledge University to take a global, non-governmental, international approach to environmental education, conservation, and the prevention of climate change. Recently, we reached out to professionals in Tijuana, Mexico, to attempt to reduce pollution along the Mexico-United States border. This coalition includes newly formed Sierra Club Mexico section, the Mexican Chamber of the Construction Industry. In Baja California, the CMIC, the Colegios de Arquitectos de Ingenieros Civiles de Tijuana. This coalition of environmental, engineering, architectural, and education groups of the San Diego-Tijuana region will attempt to understand problems of leaking sewers and water mains with the goal of reducing illness and sewage spills that create health concerns for the citizens of Tijuana and residents along the Tijuana River, which flows from Mexico into the United States. Sierra Club is also sponsoring the Ready for 100 campaign to get mayors across the United States to agree to produce 100% clean energy by 2050. Over 150 mayors of American cities are or have signed on to the 100% clean renewable energy goal. with each joining every day. The effort will make the U.S. federal government's withdrawal from the 2017 Paris Agreement practically irrelevant. Finally, the Sierra Club, along with many other environmental organizations, also impose the dangerous and ill-conceived border wall project between the United States and Mexico, which can easily become an environmental disaster. Michael Brune, Sierra Club executive director, stated recently, quote, "A wall is an ineffective and inhumane waste of taxpayer money. It makes no sense to spend nearly $2 billion on this boondoggle of a wall that will sacrifice access to safe drinking water, wildlife, and wild places for a false sense of security. The wall will create massive carbon emissions during the years it takes to build. Hundreds of miles of roads through environmentally sensitive areas will be needed, creating huge loss of undisturbed wilderness areas. The border where New Mexico and Arizona meet Mexico is one of the largest protected and undisturbed landscapes in North America outside of northern Canada and Alaska, where thousands of plant and animal species make their home. Numerous animal species also migrate across the border, but these migrations will be disrupted with disastrous consequences to these migratory species. A wall secure enough to stop people will also stop the natural flow of water, causing flooding on one side of the wall and drought conditions on the other. Perhaps worst of all, the U.S. Trump administration has waived all environmental restrictions, so no environmental impact reports will be conducted, and provisions of numerous environmental laws will be violated. The real threat, of course, is not from migrants, but from climate change-fueled storms like hurricanes Harvey and Irma that devastated Texas and Florida in August and September of 2017. Storms so large that recoveries will take many years. Today, international collaboration, education, and action is more important than ever. No country can put its own interests first. Globalization is a fact, economically, politically, and ecologically. Despite the ignorance of some politicians and leaders, a quality environment is the most effective antidote for disease and for enhancing human health. And this must be communicated effectively at all levels of government, business, and education. Thank you.